This gallbladder lecture will discuss the point-of-care ultrasound exam protocol.
So let's talk about indications for gallbladder ultrasound. Most commonly, you'll do this for right upper quadrant pain. Acute severe pain is suggestive of acute cholecystitis. With cholelithiasis, you may see intermittent pain or pain associated with eating. You'll also perform this exam for patients who have jaundice, which may be due to cholelithiasis or an obstructing mass. Also, if the patient has abnormal liver enzymes, this could be due to biliary obstruction or liver abnormalities, and a gallbladder ultrasound can be helpful. The most important part of any procedure is the initial setup. Before you start scanning the patient, you need to identify which probe to use, how to position the patient, as well as have an understanding of the procedure, of course. So first of all, you need to identify which probe you need for the exam. So for an abdominal exam, you'll need a low enough frequency probe that can penetrate deep into the abdomen to visualize the structures that you need to see. So most commonly, you'll use a curvilinear probe shown on the left here. Sometimes you can use a phased array probe, which is especially helpful if you need to use an intercostal approach, as it has a small footprint and can better see through the ribs. Once you have selected the appropriate probe, you need to ensure that the patient is correctly positioned. You should start the exam with the patient in a supine position. Now identify the lowest right rib and place your probe below it at the midclavicular line. See the included image. This will allow you to perform the exam from a subcostal approach. You may have learned about the Murphy sign. If not, it is when a patient stops inhalation during palpation of the right upper quadrant in the subcostal midclavicular line. This is due to tenderness over the gallbladder and is indicative of gallbladder pathology, most commonly cholecystitis. So it makes sense that we would start our exam in this location. Start with the probe parallel to the lowest rib, as this will make the exam easiest for you and set you up for success. Please pardon my lack of artistic skills here. I am definitely not an artist. I have attempted, however, a color-coded diagram of the important anatomy you will be looking for on this exam. The liver is shown in brown, the gallbladder and bile ducts in green, the portal vein in blue, the duodenum and stomach in pink, and the pancreas in yellow. The gallbladder sits along the inferior border of the liver within the gallbladder fossa. Shocking, I know. The cystic duct travels from the gallbladder medially until it connects with the common hepatic duct to form the common bile duct. The common bile duct is best identified by its course along the portal vein. The common bile duct travels through the head of the pancreas, terminating in the duodenum. Please note the probe positioning subcostally at the midclavicular line in the ideal location to visualize the gallbladder on the right image. You can also see how the gallbladder is trying to hide under the last rib, which may make it difficult to visualize. But if the patient inhales deeply, the liver and biliary anatomy will move inferiorly, making it easier to visualize the gallbladder and the bile ducts from this approach. Let's talk about things that can make or break your gallbladder ultrasound. So as we discussed, the gallbladder is usually best seen from a subcostal approach. And making the patient take a deep breath in can help move the gallbladder into a better position to image. However, this doesn't always work. You may need to try an intercostal approach to visualize the gallbladder. You may need to change the patient's position, put the patient in a left lateral decubitus position, the left posterior oblique position, or an upright position. These may improve visualization, but they also serve another important purpose that we will discuss later. Try and image the gallbladder through the liver. For reasons we will not discuss here, because you don't want me talking about ultrasound physics, visualizing the gallbladder through the soft tissue of the liver can often improve this visualization. You want to make sure that you visualize the entire gallbladder. You don't want to miss any pathology, and you want to pay special attention to the gallbladder neck, which is where a problematic stone may likely lodge itself. Still not seeing the gallbladder? Maybe the patient isn't fasting. Maybe they just had a big fatty meal and secreted all their bile and the gallbladder is decompressed. Maybe they forgot, but their gallbladder is surgically absent. Or maybe the patient has a fatty liver or lots of bile gas in the right upper quadrant, which can obscure visualization of the gallbladder. Okay, here we are looking at the normal anatomy of the gallbladder on ultrasound. The gallbladder should be imaged in its entirety to look for dependent stones and other pathology. Images in both the trans and long positions should be obtained. Shown here, trans on the left and long on the right. Attention should be paid to the nice, thin, echogenic gallbladder wall, as well as its completely anechoic or totally black contents, indicative of only simple bile within the gallbladder. There is no pericholestic fluid or fluid in Morison's pouch between the liver and right kidney. The visualized portions of the liver and kidney are also unremarkable. On the left, you can see the inferior vena cava overlying the vertebral body. This is the image that shows the gallbladder in the trans orientation. The image on the right shows the gallbladder in the long orientation. It is important to identify the portal triad during this exam. As the largest entity in the portal triad, the portal vein is the easiest to identify. Note the echogenic walls of the portal vein, an important distinguishing feature of the portal vasculature. The common bile duct and proper hepatic artery run together with the main portal vein. Some call this the Mickey Mouse appearance, with the portal vein as the face and the hepatic artery and common bile duct as ears. See the included diagram. The common bile duct is easiest to identify by its lack of blood flow. Therefore, when measuring the common bile duct, it's useful to put color flow on to confirm that you are measuring the duct, which shows no blood flow, and not the artery, which would have blood flow. On the left, you see the common bile duct running along the top of the portal vein, showing no color flow, with another image on the right of the common bile duct adjacent to the portal vein just before the portal vein branches within the liver.